All right, well, thank you all for joining us. Looks like we've got everybody rolling in at this point. So anyway, thank you. Welcome to Tuesday, 11 months into the pandemic. Um, and thank you for everybody that's joining us live here on Zoom. And for those of you that are going to be watching this on demand in the future as part of the series that we've been uploading onto the Smith & Jones website. This is being recorded on February 23rd, 2021. And I mentioned that because a lot of these technologies, policies, and things that we're going to be sharing in the next sort of half hour or so may be changing, and certainly changing very rapidly in the current environment that we're in. So what I want to do is start the presentation. I'll begin doing some screen sharing. So when we set out and promoted this topic, proving healthcare marketing ROI, or you'll hear me call it ROMS, return on not necessarily investment, but on marketing spend. What I had noticed over the last few weeks as the registration came in, that we really didn't have a very homogeneous group. We have a mixture of urban, suburban, rural, large hospitals, small hospitals. So I thought I would present this in a slightly different manner. I'm going to take a step back a little bit and just try to come up with the sort of least common denominator on topics that I think will be relevant to the broadest set of marketing departments. And this takes into consideration, one person, two person departments, and so it may be others as well that that have more robust departments and the ability to deploy more robust campaigns. So with that in mind, I hope that this is relevant to everybody that's here. And given that we've got a bit of a niche conversation, I will try to moderate questions. So if you have anything in particular that you think might be relevant to the broader group, please put notes in the chat, or I will try to answer offline if it's something that might be more specific to your particular institution. So with that, hang on one second, I'm just going to get all right, so as sort of a table setter, there's this great quote, and anybody that's been in marketing or advertising has heard this before. Half the money I spend on advertising is wasted. The trouble is I just don't know which half. And I think that speaks to, very much, I think, to the issue that we're going to be talking about today. So with this in mind, I want to kind of go through, and again, for a lot of you that registered, if you've given us, or if you want to put your email address in the chat, or if you've registered through Eventbrite and received the notification here, I think we have your contact information, and we're going to be sending out a copy of our book, Under the Influence. But when we wrote this back in 2018, it really took into consideration that we're really only harnessing 5% of our data. I really don't believe we've come that much farther ahead. And so this conversation will be a little bit more about the potential for measuring ROI within healthcare organizations and some of the tools that can be done to do that. And part of the reason we wanted to have this conversation now was during this sort of COVID pandemic, we all saw very early on a pause in elective procedures, which really hit hard in terms of the revenue that our institutions could realize over the last year. So with that in mind, I know that a lot of our clients, and perhaps many of you watching us, live or viewing this on demand, are going to be looking at some challenges. You're going to have trustees and CEOs that are really going to be even more demanding as your budgets get cut. Being able to prove what's working and not working is going to be, a bit of a demand in the coming year. So we'll talk a little bit about, and again, to try to make this as relevant to the group that I saw register, why we need to think like lead gen sales organizations. And we'll talk a little bit about the metrics, what that patient journey can look like, and some of the tools that we're recommending. But again, I'm not here to pitch any particular software platform. We're pretty agnostic ourselves. And I think it's important that this conversation also be flexible, depending on what electronic health record systems, what your enterprise software is, if you have a separate CRM, or even if you're using any automation marketing tools. I wanted to keep it kind of broad as we went through here. So I'm Paul Fahey. I'm a vice president with Smith & Jones, Healthcare Marketing Communications, authors of our current trends report, a lot of our blogs. Oh, and Katie, I forgot you, and you're even probably here watching this. I have an older slide, which I kept Lisa and Sharon on here, but I apologize. I'm doing a disservice to Katie Soros, who's been a really fabulous contributor to our blog content over the last year, and it's getting a lot of interest. And based on that data, see, we're looking at data. It's leading us to these kind of conversations, and we're trying to get a sense of what matters to folks based on either the conversations we're having or the web traffic we're seeing on particular topic areas. So as we go through in the next sort of half hour or so, what I want to do is just start first. And I think it's important that we all, I hope, our institutional cultures look at marketing as a revenue generating department, and not necessarily overhead or a necessary evil for communications. I know culturally, things differ depending on physician personalities and institutional strategies. Some institutions have a stronger brand than others, and it has its own gravity, drawing patients in. But I think it's important that we acknowledge that marketing can and needs to be a revenue generating department and not necessarily a line item for overhead. So what are some of the challenges as we look to measure ROI, as we look to some of the metrics? First, I think, as I mentioned before, there's increased accountability for return on marketing spend. And I'll talk about this in a second. I know this was promised as an ROI type of message, but given that I can't imagine more than 5 or 10% of the institutions out there are really harnessing all of the data. I believe it's going to be more important to think of it as a return on marketing spend and how far through that funnel we can track things. I think one of the other bigger challenges is that convergence of marketing and IT. And I would say for us, maybe of the 50, 70 clients that I've worked with over the past 10 years or more, almost all of them have different silos. Perhaps marketing and IT roll up to the same VP, but I think it's essential that they're in the boardroom together, that they somehow are linked, solid line, preferably dotted line, okay, on org charts, but absolutely must be part of that entire digital continuum from ads through all of your electronic assets, whether it's the website or social media or your enterprise software. But really essential that these organizations or these different departments rather get together and be working together, closer than they ever have been. Automation, measurement capabilities. Again, do we have the tools and talent in place? Are you using anything in particular? And if at the very basic level, it's Constant Contact and MailChimp, fabulous. If it's something more robust like HubSpot and Salesforce, Health Cloud or Marketing Cloud, so much the better. And if all of those are integrating with your CRM, that's part of your enterprise software, that's great. And do you have the team that can do it or the resources to be able to outsource it? Not all of this is in play necessarily. So I think that's some of the challenges that we face. And then also the ability to segment for one-to-one patient-centric marketing, which is certainly one of the trends that we've seen over the last decade. Patients want to be spoken to. They want to be dealt with on a one-to-one basis. They've become more demanding than ever before. And I think there's opportunities for that in this sort of COVID context to harness that even more than we perhaps have been in the past. So we're going to go a little bit deeper than necessarily a one-on-one level, but I'll try to keep this, as I said before, relevant to the broadest set of audiences that we've got here. And I'm just trying to close a window here. Bear with me one second. So we'll talk a little bit about the integration of your CRM and marketing communications. We'll talk about one-to-one. We'll talk a little bit about tracking those touch points. How can you measure that return on marketing spend in real time? And ultimately, it's that goal of what's that net revenue per patient. What did it cost us to acquire that patient? And then how profitable is that patient based on the P&L for that particular service line? And I know that that's elusive for most of us. So I thought this context of what could be might give us a sense of what we're trying to aspire to. So to be clear, this isn't really a tutorial. I'm not training you on how to set up something. but really wanted to talk about what this, scenario could look like and sort of orient us all to those different touch points. And to that third bullet, as we go through, those are the touch points that I think we want to harness into our dashboards and what we want to report out on so that we can, start to measure or prove ROI as we're going through. So the whole theme of this is wrapped around, your customer relationship, your software that's managing those contacts, integrated with your marketing, with an emphasis on one-to-one marketing and a very patient-centric, set of digital tactics. I know that that's a bit of a mouthful, but I think it's really what we should be trying to build, and what I think we're going to be under the pressure to build over the next year or so as we start to work toward better revenue models. And it doesn't mean to say that once we're all profitable, people forget about what we're spending and doing. But I think it's essential that we all try to understand that this is what our trustees are asking for, some more sophisticated than others, but it's ultimately they want to know, and we want to know, how closely can I tie my marketing to my enterprise software or my contact records. And in particular, it's the digital tactics that I believe will allow us to do this. So as I mentioned before, we're pretty agnostic. I don't care what your enterprise system is. These are some of the bigger ones that I know many of you are using. And I know for the most part, either they have their own marketing modules or they'll interface with these. HubSpot, Salesforce has its own health cloud, and Marketo, and a lot of these are tools. And again, we're pretty agnostic ourselves. We've worked in all of these platforms. In fact, for our own firm, we use HubSpot. I'm a former Salesforce sort of regional leader for sort of group communications. So we're pretty agnostic. And I think what you'll hear here is not, what we're going to describe anyway in the next few minutes, is not how to install and plug in, but just the notion that this could all work, in this. And I think it's also important to keep in mind that over the last decade and for the next foreseeable future, there have been significant media shift out of traditional into digital. And what you'll see here is, when surveyed, marketing directors are being asked, about their plans and changes for their budgets. And you'll see on the left, 39% saying, I'm going to be dropping or keeping, the orange slice there, I'm going to be decreasing my traditional media spend. And on the right, 84% saying I'm increasing. The changes in my digital marketing budgets are going up dramatically. And I think that's important for a number of reasons. Number one, consumer media. And if you've tuned into these webinars, often you've heard us say this before, consumers are or patients, prospective patients, are consuming digital media like never before, and likely that trend will continue even when we're, deeper into the vaccine and past cold and flu season. I think those consumer behaviors are going to be harder to shake, but that's good. And the reason I wanted to keep this in here is because I think that this is important. The digital marketing tools that we're all starting to use and harness and really optimize are going to give us all those data points we can use throughout that whole life cycle. We'll talk about that in a second. So once it's built and organized and harnessed, I think you'll see certainly a greater response rate. You'll be able to demonstrate that return on marketing spend through downstream revenues. And again, this is if you're perfectly integrated with your enterprise software. Then you can get into things like predictive modeling. You can look at revenue growth potential and cross-selling and upselling patients into other services. Salesforce Health Cloud in particular does an extremely good job of looking at predictors of patients. You can actually integrate, and they have a security block that keeps it HIPAA-rific, but allows you as a marketer to look at clusters of patient data and start to predict the services they might need, or your call centers have the ability to harness some of that data and look at if a patient or a patient household is being treated for certain things, perhaps they need something else as they're going through. So how it works, and again, this is might be basic and refresher for some, new for others. You may have even seen this presentation before. At the center with your CRM is that concept of knowing your patients, knowing their interactions, their behaviors, and that goes from everything from scheduling to web integration, web visits, what's the content they're reading and downloading, and what are we treating them for, and those kind of procedures. On the left, the data-driven strategies that you can embrace, not only as marketers, but your institution and your strategic planners can embrace when they start to look at those data trends, successes of service lines or utilization of service lines based on predictive data modeling. Tracking all of those touch points, that bottom circle is really what we're talking a lot about today. And then on the right, the integration of all of those data sources, again, between your marketing tools and your enterprise software. So this is probably pretty familiar to most of us. This is how it works. We run campaigns as marketers, we generate traffic and interest, whether those are phone calls, web visits, click to schedule, ultimately those will, turn into qualified leads on the bottom right. Then we can start to evaluate the success of those. What did it cost for us to acquire? And we'll talk about a bariatric case study in a second. What did it cost for us to evaluate that success? Of those different patients? What was the cost of acquisition, and even what was the success of their journey? What was the promise that we put out there as marketers, and how was that delivered in terms of their experience? And then ultimately, how do we optimize that entire experience for the patient, both optimizing their marketing experience, but what was the operational experience? What were those patient outcomes? And it becomes a very cyclical process, obviously. So at the top, we have what probably most of us are doing or trying to do. And at the bottom is that true ROI. And I won't read this word for word, but it's that general sense of we have data sources and we can perhaps look at patient profiles and, heat maps and those kind of tools, not only in terms of where our patients are coming from, but heat maps on our websites. We can look at leads, perhaps, depending on the service line and the types of tools that we're using and those conversions. And sale ultimately. And for that, and we'll describe this through a bariatric case study in a moment, all of that rolls up and it's the data we get from contact tracking and all of that. And, hopefully we can at least do some of this on some level. We have resources, both human and financial. We're putting out our marketing programs, perhaps on something like a bariatrics campaign. And then we're looking at what are those patient journeys from, awareness through. True ROI and true integration at the best and highest levels, and this requires a significant amount of not only financial resources, the integration of your marketing materials and software, but also some human resources to be able to look at this and actually, look at it can benefit on all of these things. You can look at, predictive modeling. If we have these patient successes, we put ads out, for instance, patients saw those, they went to an information session, they signed on, we decided surgery was the right approach for them. They were successful at keeping the weight loss off, and they move forward, through the rest of their lives. If we see that happening in certain neighborhoods, then we could do predictive modeling in others where we have that demographic data available, or based on a smaller sample size and a smaller spend, we could interpolate, larger, better opportunities. Again, I think that's probably the holy grail that many of us are looking for. So what does this look like in a little bit more detail? So on the left in that vertical column, you'll see this mix of integration of everything from clinical records to billing records to your call center, your market intelligence, depending on the sources you have in whatever state you're in. And certainly as marketers, that web and social media and e-blast data and all of that. That information, when brought into those funnels, and working either with a consultant analyst or a staff analyst, can start to process and synthesize that, going into a very patient-focused data warehouse. And that's important stuff for us to have as marketers, because that's the data we're going to want to know. And I think this next slide will clarify that journey a little bit more. But the point I want to make here is the importance of sort of integrating and connecting those silos. To my earliest point, I believe the importance of, many of these things that you're seeing me describe here are not even necessarily individual silos within your organization. In some cases, these are completely different departments. On the left, it might be 4 different departments, and how well do those integrate? and who is that single, team that's helping to synthesize and analyze all that data that can then be given back to everybody. But in this case, I think we're coming at it from sort of a marketing communications perspective. So with all of that in mind, I think building out and understanding what that health engagement cycle is, I think is very important. And I think I'll just go to the next slide. No, let me start on this slide. Patients will start at the left, and in a perfect world, they will continue all the way to the right. At the very earliest stages, they will, consider themselves start to self-diagnose. I either have a set of symptoms, I have a current, issue, an injury, what we call the worried well. They then move into becoming information seekers, learning more about either the condition that I might have, what my physician and I, my primary care physician and I were just starting to talk about. And those information seekers are going to start to gather knowledge. And that could be everywhere from WebMD to your website, to Dr. Oz. Who knows where everybody's getting their data from these days. They'll then move in that continuum into being treatment seekers. They've come to some sort of conclusion that I do need to take another step, either from the advice of my physician or on my own motivation. I've learned that I need to take that first step or the next step to actually seeking treatment. And we've actually done, many of you may remember other webinars that we've given where we've put those patients on a spectrum. On the left side, we had what I used to call the Murphy Browns, dating myself because that's an older analogy, but you had very strong-willed, very empowered patients or people or personalities that are going to take control of their healthcare. On the other end of the spectrum, you have what I call fix-me's. These are patients that basically say, you've got the diploma on the wall, doc, whatever you tell me to do is what I'm going to go do. No matter where they're at on the spectrum, they're thinking about their health on that first tile. They're seeking more information about it, or they're being told more information about it. But at the red tile, they're seeking treatment. Now we're going to look for a provider to deliver on that treatment. Then they become hot prospects. Ultimately, they'll move into patients, and based on successful outcomes and nurturing, and I think this is an important piece, post-operative, for example, they can be very strong advocates for your organization and help that cycle come through. So if you were looking, for instance, maybe it's orthopedic sports medicine, the tactics along the bottom, the icons that I've sort of just dropped in here, worried well, we'll be looking at search engine marketing. And maybe even some opportunities to sign up for a newsletter, get some email information. You can reach them through social media. As they get a little bit farther in, you may want to use things like retargeting, and this is where you can start to keep in touch with them, stay in touch with them, get them to join a group, but keep, connecting with them. Then as a patient, you're going to be interacting through, obviously, visits and follow-ups and office conversations, but email marketing, I think, is one of the more prevalent tactics there. And then as advocates, they tend to go out and celebrate what's happening, successful outcomes, and then they become advocates for you, your organization, your brand, and then they become advocates for what your institution, in particular. And with that in mind, within that different continuum, and you'll see that down here on the left, through interest and consideration and trial and retention and advocacy, it's important as you try to reach them on a one-to-one basis that each of those messages becomes a little bit more acute and targeted for those different stages. So for instance, at the interest stage, you simply want to raise awareness. What are the causes of my illness or the triggers of my illness? When could I expect distress? When patients are at the consent, and so those might be messages you put out, in search terms or in some of your social media postings or advertising. When patients get into more consideration, then it's what are the treatment options? And as you bring them farther through and they're learning a little bit more, then you start to introduce your specialists, and then the follow-up care. And ultimately, when it comes down to advocacy and post-treatment procedure as they're in recovery, and hopefully becoming advocates, is when you can start to reach them with messages about the best technologies, the best doctors, and those kind of things. So as I mentioned before, I wanted to describe a little bit about a sample campaign. So let's take people through this sort of bariatrics model. Our goals for this would be obviously engaging prospective patients and then get them through that decision-making cycle to consider it. It's our first set of goals. And so you'll have your advertising in all those different forms. Again, I think we're really strongly advocating for more of a digital basis. Moving into calls to action for information sessions or call or finding some of that information on my website. Ultimately, that's where your lead generation and capture pushes them into your CRM. Then you're going to deploy your automation, your email marketing, as well as retargeting to, keep it sticky, stay in touch, help them, nurture them through that decision-making cycle. Education sessions are going to be, really important once they've learned more from an information type of session. Now let me educate you about the processes and steps and options and things like that. You'll get into your consultations and then ultimately decide what's the weight loss program that's right for you, whether it's surgical or maybe a multi-faceted program. Then you want to facilitate that sort of pre and post. In this case, it assumes that there's a surgical recommendation, but then you'll facilitate sort of pre and post surgical education that drives that behavior change. You're going to look at, completion of those patient programs, completion of a weight loss program. You're going to be connecting with those folks, not only through email open rates. You're going to be looking at drip email campaigns. You're going to be looking at conversations and chats that are happening within Facebook groups. How engaging is that community? What are they talking about? And measuring those completions of calls to action as they go through. They certainly become, certainly we want to keep them on track and engage them really very much. I mentioned this at the beginning of the webinar, very much like a retailer would. Everything you're seeing here is everything that is happening at major retailers, whether you're Walmart, Amazon, LL Bean. These entire processes just change the words from bariatrics to boots, I guess. I hadn't scripted that, so feel free to put in the chat whether that was a Dopey analogy. Trying out these things as I go along here. And so what that looks like, again, to drop this sort of chart back in here, they're going through those different steps. We're engaging them through search and all of the metrics. What are the keywords we're bidding on? Who's clicking on what? Which keywords are performing better than others? And again, this goes all to those things that we can start to prove, but I think it's important to put that in the context of what this patient engagement is. How do you evaluate, qualify and prepare them for the procedures as they go through surgery, following up on that, post-surgery, behavior change and success. Those are all the steps on the left that takes them through the continuum that we described before and where all those tactics are. And again, as we were describing earlier, that shift away from traditional media into a much deeper digital media environment, this is what patients are, or what we as marketers are able to embrace. We have all the data points we could possibly need through all of the tactics that are at the bottom, from search, email, social, retargeting, everything else that we're using there, can help us measure how they're moving through these different processes. The challenge, and the bigger challenge that we identified at the beginning of this talk, is how integrated are our departments and how integrated are our software systems that we were describing earlier. And even from a before and after, and in both cases, your website will have an important presence, as well as digital engagement through remote devices like tablets and phones. The one thing I wanted to call out here on a pre-surgical engagement is, what's the kind of information? Again, all of this is measurable. Now you're into your Google Analytics or your site analytics. They're filling out forms for self-assessment. They're online chat within your system if that's available. They're connecting directly to schedule appointments, or in many cases those sort of virtual settings. We believe that the web itself, I think I can probably even go back a couple slides. No, I didn't drop it in. But if you can see my cursor on screen, I think your website lives somewhere here between the worried well and information seekers. When they're looking for information, certainly WebMD is going to outgun most of us from an SEO standpoint. But if your site can be the local interpretation for that, or the local resource for something, so much the better. It doesn't mean that you necessarily need to compete with all of the content libraries as deep as something like WebMD might be. But I think it's important to keep in mind that they will be looking for a local once they've done their sort of generic research, they're going to be looking for a local resource for that. And then post-surgical engagement. So as I go all the way to the right on that chart that we described earlier, what are our patients doing? What kind of reminders can we have? What kind of device integration do we have here for tips? In this case, different what I call micro educational content. What's my BMI, and can I track that on an app? Or can you send me links to your website that might have those calculators or calorie counters, or tips and things like that. All of those will help. And again, the integration of everything from app downloads to app utilization can be integrated with some of the more robust tools. And ultimately, the sort of holy grail of our what I'm calling ROMs, return on marketing spend, more so than our true ROI, I think can be part of what we should all be aspiring to. So I think it was very important to describe this whole sort of picture. And a lot of this can be done in real time. So in this final section of the presentation today, describing, we have our own product, Overlytics, which looks to integrate all of those other, all the marketing touch points, all the digital marketing touch points, and even traditional media has, vanity call numbers that can be tracked through something like CallRail. But largely what I'm focusing on here is more of a digital marketing strategy. So again, the more robust platforms like even Salesforce Health Cloud can start to look at cross promotion of services, identify patient communication preference. What are those different touch points throughout the system? What is the utilization of new patients versus recurring patients? What is your household loyalty? Now I'm starting to talk like a financial institution. Financial institutions are developing really robust programs. Once they've got their foot in the door with one product for one household, they do an extremely effective job cross-selling to other members of those households. And it's a concept called full family marketing. If I've got one person that has an auto loan, well, could I help you with your refi or your first mortgage and your child's college education, or home equity loans, or all those other things? How many different credit cards are in that household? How many different checking accounts are in those households? Can I nurture the children in the household through, school banking? All of that, and all of those behaviors that are happening in the, we're in a unique position to be able to cross-pollinate ourselves, because we have a sister company between Smith & Jones with Overit, the ability to work with those teams that are, diving that deeply into things that are very lead generation, like home services, pest control, financial services. All are very demanding platforms. And so a lot of what I'm describing here, we're cross-pollinating between those two companies. And the dashboards, these last couple slides that I have here, really are examples of what's, in this case, that Salesforce Health Cloud can generate. It will start to look at, patient load and conversions by conversions, not only conversions, but conversions by source. They have referral dashboards in terms of which physicians are sending referrals, and what are those referral insurance types, and what types of specialties are coming from those different referrals. So while largely I've been talking about sort of direct to patient communications, there's also integration here within other sources of revenue, like referring physicians, that can be tracked as well. Reaching those physicians is, I think, even a greater challenge, and probably a topic for another day. So I'll largely keep it on, what we've been describing, that sort of direct to patient. But I wanted to share this slide because I think it's important to know that depending on the platform you have, you can start to track not only your marketing revenue from an advertising and media standpoint, but also if you're fortunate to have physician relations teams that have a set of activities, you can see that as it goes through. And then even at the most basic level, I've redacted a sample, the integration of, AdWords data and ad groups, looking at trending over time, looking at some of the analytic data, which then results in calls. None of this is going to be perfect. And I think for the many of us that are on the webinar today are merely going to be able to track, some of the data performance from some of our advertising, whether it's keywords or social media as we're going through, and ultimately bringing that forward to some singular call to action, whether it is a, click to call or scheduling an appointment or going to the website for more information, but being able to track that continuum through what I was describing previously is really what I wanted to cover today. I think just to describe the scenario to folks, if your trustees are not sophisticated enough to ask if you're doing all of this, this is ultimately what's in their mind about where they want to push your institution. Ultimately, the question is, do you have the human and financial resources to be able to do a lot of that? So ultimately, at the end of the day, integrating not only your marketing systems with your CRM, your enterprise software, is going to help you certainly move the dial on your business goals. I think it's going to help you improve your ROMs. It'll allow you to segment service lines, push you to a deeper sense of one-to-one patient-centric marketing, which has always been the holy grail, and sort of builds deeper relationships and ultimately brand loyalty. And also, the automation and being able to tie what you're doing on year one in terms of marketing tactics to other revenue downstream. So those final considerations, and what I'm trying to do is echo what I talked about before, starting with, or maybe these are even some, things to keep in mind as you're beginning that process. What are your organizational goals? What is the service line growth strategies and objectives, as laser focused as you can be? Having a deeper understanding of that infrastructure and process and staff training and expertise, then it's just a matter of integrating those departments and technologies. And ultimately, all these folks need to be at the table, whether it's marketing, which is different from communications, fully integrated with IT. I put those two at the top because I think they need to be working closest together. Then it evolves into C-suite, endorsement, anything that might be considered patient experience teams, business development, service lines, VPs or directors. I think, these are the folks that need to be supportive of the work that we're doing, supportive of our budget requests for these systems and processes, and ultimately a lot of what they're, ultimately going to be asking for. So thanks. I went through this pretty quickly. I know we wanted to keep this to about a half hour or so. I'm running a few minutes long, but I did want to share, again, as I mentioned at the beginning of this conversation, we had a very diverse group of folks that were attending, a mix of, small, larger institutions, urban, suburban, rural. So I think the resources many of us would have might vary a bit. But what I ultimately wanted to describe and what I hope came through is the sense of, what can an ROI or return on marketing spend look like, overlaid to that continuum of patient engagement through the whole process. So thank you again for all of you that were joining us live today. For those of you that are going to be watching this on demand tomorrow, we did promise copies of our Under the Influence book to folks that registered, so we'll be following up and getting those out in the mail to you in the coming days or weeks. If there's anything that I'm describing here, because there was a lot to unpack, I think, in this conversation, and you may have more specific, how do I get started, or how do I optimize what I'm already doing? Happy to be a resource, to field some, preliminary questions and learn more about what's keeping you up at night. So we can certainly chat offline with us as we're going through. So let me just see if I've got time. I can do one quick. Attribution tracking can be difficult, yes. And I think some of this, Carolyn, I can even answer offline, but I think is the best methodology looking at aggregate numbers for each stage. Yes, I think at the very basic level, aggregate numbers are going to be good. UTI tracking as you're going through will be very helpful. And I can even reach out to you offline on some of this. There's a couple, actually, I think I've even got a link to a blog article that I can share with you on this. But determining where like a scheduled visit came from, yes, you're going to have some aggregate data that'll happen, and it's very easy to access that. At the very least, and depending on the size of your institution, a well-trained intake department can then start to identify, so how did you hear about us? And at least get a couple of those little things. It'll be pretty imperfect, but better than nothing. But I can follow up with you offline on some of this as well. So I hope that answered your question. And you're welcome. Well, thank you, everybody. Thanks for tuning in. We have another webinar at the end of March, and we'll be announcing that topic, and will be in your inbox for invitations to join us for that as well. So thank you for tuning in. Enjoy the rest of your day.